Mr. Desmond, good morning.
Hello.
Good morning, sir.
Good morning. So this morning we'll be taking the concluding part of our class. Are we together?
Yes, sir. We are together.
Only, sir.
Good morning. We'll be taking the concluding part of our class, and that's the second aspect that has to do with psychotherapy. Yesterday, by God's grace, even though the network gave us a series of challenges, we're looking at what counseling is. We said it is a relationship. We said it's a relationship between a counselor and a counselee, or the relationship, the interaction between an individual, group of individuals, a family, or a couple with the aim of finding solutions to their, or receiving help from a professional to their challenges. We're very quick to also see that counseling is not just an act, it's a process that takes that is a step-by-step process. It is not done haphazardly. It is done in a coordinated way. And we saw that when you have a person coming to you to seek help or counseling, you first build a rapport with that person. You establish a relationship that is therapeutic in nature. That is, the relationship is aimed at helping the person overcome his own challenges. We saw that when you might have built a rapport with that person, you are able, when you have built a rapport, you are able to make the person feel comfortable so that he will be able to, open up to you what his challenges are in order to receive help. We looked at the stages of counseling. It begins with rapport building. It has to do with problem assessment, has to do with problem evaluation. We also say that process leads to the termination phase, where the counseling session comes to an end, because every counseling session that has a beginning also has an end. This was what we were saying yesterday. I will say that in the process of counseling, beginning from building rapport to problem assessment, to goal setting, to exploration, intervention, evaluation, and termination, the counselor also needs to be very, very careful, because the counselee is also assessing him. He's taking note of his nonverbal action. We were able to look at who a counselor is, and we say he's a trained person who has the professional skills to provide guidance, support, and therapy, either to an individual, group of individuals. It could be a couple, it could be work-related problems, it could be relationship or other challenges. And we say that for one to be a good counselor, he must develop empathy, he must develop effective listening skills, he must be a good communicator, he must ensure that he assures the claim of confidentiality, that is, giving the client assurance that the information they are going to discuss is information that is not going to be shared with anyone. We looked at what confidentiality is. We looked at how confidentiality can be maintained. We also looked at cultural issues relating to counseling. And we rounded up by looking at the types of counseling. And we say that counseling can be done individually. It can be done in a group. It can also be done to a family. And when it is a group, they must have common challenges. Are we together?
Yes,
Yes,
sir.
sir.
We're together.
I think these were the issues we looked at yesterday. Looking at the title of our course, it is Counseling and Psychotherapy. So this morning and today, which is going to be the final encounter with me, and then Dr. Dorothy will take over, we'll be looking at psychotherapy. We'll look at what psychotherapy is in relation to counseling. We'll look at what how psychotherapy, can be conducted, the types of psychotherapy, and techniques of conducting psychotherapy. And then we'll conclude our class for today. So by way of introduction, we want to say that counseling and psychotherapy, are both forms of mental health support that involves talking to a trained professional who is able to address emotional, psychological, and behavioral issues. They are all forms of talk treatment. Are we together?
We're together.
Yes, sir.
So, yeah, so when you go to the hospital, you receive treatment. You see a doctor, he talks to you in form of asking you questions that is called assessment. He asks you, yes, what is the problem? You tell him that, yes, this is my problem. I have headache. I have stomach pain. I have not been able to sleep. Tell you this, that, this, and that. When you must have finished talking, he writes a prescription and gives to you. The prescription can be in form of drugs. The prescription can be in form of investigations. That go and do these investigations and bring it back. He is telling you that, yes, these things you have said, I am suspecting this is the cause. So go and do a lab investigation, go and do an X-ray, go and do this one, do this one, do this one, and let me be sure that this is exactly what is your problem. Then you go to the lab or you go to the radiology unit, you do this test, and then you bring the result. He prescribed medications for you to go and take. And when you take, they become well. You become well. That's medical treatment. But in counseling and psychotherapy, the talking itself is a treatment approach. But while you are talking, you are also telling the trained professional what your problems are. And your problems could be emotional problems, they could be behavioral issues, they could be psychological issues. Now, when he has listened to you, he is able to also come up with a diagnosis. Now, in some instance, he is also able to administer some tests. They are called psychological tools, or they are called assessment tools, just like a doctor will ask you to go to the lab. But here, these tools are also called tests. They are not run in the lab, but there are some that are run in the lab in a controlled environment. And then he is also wanting to confirm further, without doubt, that exactly these emotional problems are what he is also envisaging, or these psychological problems, this is what it is, or these behavioral issues that you have raised in the assessment, this is the extent to which they have affected you. So both counseling and psychotherapy are forms of mental health support that involves talking with a trained professional to address them. So psychotherapy and counseling is a form of talking cure provided to patients or clients in order to alleviate or address their emotional, psychological, and behavioral issues. As much as they are similar, they differ in several ways from one to another, depending on their goals and also duration and the type of issues they are able to address. So even though counseling requires talking to a client, psychotherapy also requires talking to a client or a patient, but they differ in the goals and in the issues they address. That's their difference. Are we followed to this point?
Yes, sir.
I hope we are not confused.
Not at all, sir.
Okay. So looking at psychotherapy, yesterday we were able to dutifully look at what counseling is. So what is psychotherapy? Now, psychotherapy, when you look at the word psychotherapy, it is derived from two words, psycho and therapy. Now, psycho, when you slice psycho and therapy, you have two words. Psycho means mind, and therapy means treatment. Now, when you put it together, it becomes psychotherapy. But when you want to look at them in their separate, from their separate meaning, anywhere you see psycho, it means mind, whether it is psychoanalysis, whether it's psychotherapy, whether it's psychodynamics, it means psycho anywhere means what? Mind. So if it is psychotherapy, it means the mind is treated. That's because therapy means treatment. Psycho means mind. If it's psychoanalysis, it means the mind is being analyzed. If it is psychodynamic, it means the mind is changing. Are we together?
Yeah.
Yes,
Are we understanding?
Yes.
So
Yes, sir.
psychotherapy means treatment of the mind. Treatment of the mind. And it is also referred to as a talk therapy. This is a type of treatment that requires a professional talking with a client or a patient. I'm using the word client and patient because somebody can walk into your office to see a psychotherapist. Are we together? Such a person is called a client. But when somebody is admitted in a hospital or in a rehabilitation center and he needs psychotherapy, he is no longer a client, but he is a patient. That is why I'm using the word client or patient interchangeably. So psychotherapy is also known as talk therapy. And it has to do with it is seen as a technique, or it is referred to as a technique that helps people change behavior, change thoughts, change emotions that cause problem or distress. If you recall in our first semester where we were looking at psychopathology, you know, I had explained to us that anywhere you see psycho means what?
Mind.
Mind. So when we say psychopathology, pathology means abnormality or something is wrong or sickness, isn't it? So in our course of psychopathology, we are saying the mind is sick, the mind is distressed, the mind is abnormal. I had mentioned that there are 4 to 5 basic causes of psychopathology. And we say that there are environmental causes, there are genetic causes, there are biological causes, there are psychological causes, and there are social causes of the mind being sick, or reasons why the mind can be sick. And when the mind is sick, it manifests itself in behavioral terms. Is that okay?
Yes.
Yes, sir.
It manifests itself in behavioral aspect or terms or aspects. Now, we are saying that psychotherapy is a form of talk cure, and it is aimed at changing behaviors changing thoughts, changing emotions that cause problems or distress. So when the mind is sick, it presents itself in behavioral terms. It manifests in behavioral forms. So our behavior changes when our mind is sick. Our thought processes also changes. The way we interpret stimulus, also changes. And the way we respond to emotional stimulus also changes. It shows that there is something wrong with the mind. So people change behavior. They behave in ways that deviate from the normal behavior in the society. People think differently. And these thoughts, the way they interpret or the interpretation they give to situations around them, tend to affect the way they behave. The way they express their emotions, also affects the way they behave. For instance, somebody is bereaved, and while everybody is crying, he is busy laughing up and down. Is that a normal behavior?
No, sir. No, it's not normal.
It is not normal because when there is a bereavement, people do what? People weep, isn't it?
Mourn.
So it shows that there is something wrong with the mind. So psychotherapy seeks to help people change behavior when the behavior is abnormal. Psychotherapy seeks to change thoughts when the thoughts are abnormal. And it seeks also to modify emotions and bring them back to normal. Is that understood?
Yes, sir.
Yes, sir.
Yes, sir.
So we are saying that psychotherapy is an umbrella term for treating psychological disorders and mental distresses through verbal and psychological techniques. So during the process of psychotherapy, the therapist is trained to help a client to be able to understand and tackle specific or general problems, such as mental illnesses or a source of life stress. Everybody experiences stress. Everybody experiencing stress. Yesterday, I remember when the network was giving us issues, there was an uproar in the class. And when I returned, I heard the class rep, governor addressing the class. And somebody told the class governor to stop quarreling with them. And one person said everybody is expressing his own degree of madness. Was that what happened yesterday?
Yes, sir. That was exactly what happened.
Yes. So everybody's saying, I think it was Ralph. Ralph said everybody's expressing his own degree of madness. Now, everybody is stressed. Everybody is distressed with the present economic realities. And there is always a deviation from the normal. And then these life stresses, when an individual is unable to manage them, to develop resistance or adapt to the stress, adapt to stress, he seeks help to overcome his stress. So that person seeking help is a client trying to seek help from a trained professional called a psychotherapist to help him address general issues or sources of stress in his daily life. And then people also suffer mental illnesses. When you go around town, you see people with a lot of mental health issues. Some are suffering from schizophrenia, as we saw in our course in psychopathology. Some are suffering from mood disorders. Some are suffering from psychosis. Some are suffering from substance use disorders. Some are suffering from attachment disorders. Some are suffering from separation disorders. There are a lot of issues that keep bombarding our sensory system, triggering mental illnesses and mental health issues that will require the help of professionals. So when we have this kind of issues, we go to the professional, we seek help, and he talks to us, helping us realize that how our behaviors, how our thought process, and how our emotions have caused our distress, and they help us overcome them. Are we understanding, or are we understood to this point?
Yes, sir.
Can we make progress?
Yes, sir, we can.
Okay. So, depending on the approach used by the therapist, a wide range of techniques and strategies can be used by the therapist. Yesterday, while we were looking at types of counseling, and approaches to counseling, we say that depending on the counselor's orientation, he can adapt any approach in managing or in providing counseling services. And somebody asked, what is the place of referral? Even in psychotherapy, it is dependent on the therapist's orientation. The therapist's orientation has to do with his background. It has to do with his bias. So all these therapeutic approach, just like we explained yesterday, are able to treat all individual issues. But there are also some therapeutic approaches that are suitable for in managing certain behavioral characteristics or manifestations. So a therapist can have an orientation in the field of cognitive therapy. He can have a orientation in the field of behavioral therapy. He can have orientation in the field of humanistic therapy. He can have orientation in what we call the rational emotive therapy. Depending on his own orientation, he will attend to the needs of his clients as he deems fit at each point in time. So almost all types of psychotherapy involve developing a therapeutic relationship, communicating and creating a dialogue, and working to overcome problematic thoughts or behavior. So whether the person has mental illness or has mental health issues or has mental disorder or is just life stress, whether it is anxiety disorder, whether it is substance use disorder, whether it is intellectual disability, whether it is attachment issues, the therapeutic session begins with establishing a rapport, building a relationship with your own client so that he or she will be able to feel comfortable and also interact and relate with you as a client. Are we together? As a therapist?
Yes, sir, we are together.
Have you understood to this point?
Yes, sir.
Is there any question?
No question.
Okay.
Sir, you can go over it. I'm just joining, so I can't respond that there's no question. So you just take it more small, sir. Thank you.
Okay, we are saying that just like we established yesterday, that depending on the therapist's orientation, the therapy can adapt any form of therapy for a particular situation. But we say that whether the person has your client has mental illness, or he has a mental health challenge, or whether he has a mental health disorder, or whether it is an anxiety disorder, whether he has intellectual disability disorder, whatsoever form of disorder, whether it is life stress, but the therapeutic session begins with establishing a rapport, building a relationship. That's what we are saying. That the therapist must first build a relationship with the client in order for the client to be assured, to be comfortable that yes, he can discuss with the therapist, just like we said about counseling yesterday.
Okay. Notice, sir. Thank you.
So many different types of professionals offer psychotherapy. Now it's including clinical psychologists, psychiatrists, counselors, marriage and family therapists, mental health counselors, and social workers. You know, they try to provide help. But for psychotherapy, you must be a trained psychotherapist to offer psychotherapy. So somebody who is offering behavioral therapy must have been certified, trained in the techniques of behavioral therapy. Because when you begin to look at one form of therapy, it has different approaches to it. For instance, if you look at behavioral therapy, there are several approaches to it. We talk about issues of reinforcement as a technique. We talk about token economy. We talk about aversive therapy. We talk about systematic desensitization. We talk about non-reinforcement techniques. They are all techniques under behavioral therapy. So somebody cannot arise today and begin to offer psychotherapy as a behaviorist. He must be trained. So as different types, as several professionals are in the mental health profession, they must be trained to offer this form of treatment, whether they are clinical psychologists, whether they are psychiatrists, whether they are counselors, whether they are marriage and family therapists, whether they are mental health counselors or social workers. They must offer they must specialize in order to be able to deliver on this therapy we are talking about. So having said that, psychotherapy can take different formats depending on the style of the therapist. This we have established already, and also depending on the needs of the patient. So we will take a look at the different types of therapy we have. They are similar to that of counseling. Yesterday in counseling, we had mentioned different types of counseling. What did we mention yesterday?
Family counseling.
We mentioned family counseling. We mentioned individual counseling. We mentioned group counseling. And then we also
Family counseling.
we mentioned family counseling. Now, in psychotherapy, we also have individual therapy. We also have individual therapy as a type of therapy. And this has to do with the therapist having a one-on-one conversation with the individual that has a problem. The principles are related, but there's a thin line differentiating them depending on the severity of issues that are presented. So in individual therapy, the individual client or the individual patient has an interface, a one-on-one interface with the therapist. And the therapist listens to the individual, he assesses his problem, and he develops his own goal of treatment, and then he walks through it with the patient, and he is able to provide help and improve the individual's well-being. Now, just like in the case of counseling, an individual therapy may also make referral in situations where the individual needs requires other interventions that he is not a specialist or he doesn't have comparative advantages in. He makes referral to another therapist to be able to handle such situations. Are we together?
Yes, sir.
And then we also have couples therapy, and this involves working with the therapist as a couple to improve how you function in your relationship. You also notice that in couples counseling, the individual couples go to the counselor and they discuss, problematic issues in their relationship, and they are helped, and that improves their well-being. So even in a couples therapist, the therapists work in order to improve how the couples function in their relationship. And this is same with family therapy. And this has to do with improving certain dynamics within the families. And he can also include multiple individuals within the family unit coming together to resolve challenges that affect them as a family. Now, also in group counseling, just like group therapy, it involves a small group of individuals who share common goals. Who share common goals. Now, these people have unique characteristics that put them together. For instance, you have a group of people who are substance abusers and have been going through therapeutic session, at different levels, but they can come together in form of group psychotherapy. The group psychotherapy is very, very important. It is guided by principles. It differs significantly from the group counseling because in group psychotherapy, the psychotherapists only moderate the group sessions while the individuals express their challenges and share their experiences of their challenges and how they were overcoming or how they have overcome them to help other members of the group also receive healing from their own experiences. So in group psychotherapy, there are 12 healing factors that a successful group psychotherapy is able to bring forth. To mention briefly some of them, we talk about altruism, which has to do with helping others without looking for a reward. We talk about impartation of knowledge. As group members share their knowledge, their experiences, they are imparting knowledge into others in order to develop skills and techniques that they can help overcome their challenges. We talk about instillation of hope, where group members, as they share their experiences and how they were able to overcome, others who feel frustrated develop hope that they can also be able to overcome this situation. And a host of others. There are 12 healing factors in group psychotherapy as it was developed by Chairman Yalom. So as similar as they are, there are differences that are noticeable in the group psychotherapy from the group counseling as we discussed yesterday. Do we understand to that point?
Yes, sir.
Actually, you mentioned the healing factors that the psychotherapists may improve on the lives of the group individuals. Why they mention their problems individually? You
Yes.
were
Why they
about
share, not they mention. Why they share.
okay. But so you were fast in mentioning that we didn't take notice of them. I think you can go over it. Thank you, sir.
Okay, I said in a group psychotherapy session, there are up to 12 healing factors that are noticed or that come out of a successful group psychotherapy. The first one is altruism, being altruistic, that the members of the group are helping each other, but in return, they are not asking for any benefit. Altruism, altruistic factors. The second factor is impartation of knowledge. In the impartation of knowledge, the individuals receive knowledge from members of the group. As they share Are we together?
Yes, sir.
Yes. Then we also spoke about instillation of hope. That as they share their experiences, those who feel hopeless amongst the group, also know that there is hope. Their situation is not also hopeless. And I say, and a host of other healing factors that actually come out of this interaction. Are we together?
Yes, sir.
Yes, together.
It's all right. So,
Sir, I also
yes,
have a question.
please do, Ralph.
When we were discussing counseling yesterday,
Yes,
we say we made mention of the person offering counseling is a counselor,
yes,
and the person receiving counseling is a counselee.
yes.
I don't know if I'm right.
You are right.
So coming to therapy, the person offering is a therapy. The
He's a
person offering
therapist.
is a therapist, and then the person receiving is a what, sir?
He's a client or a patient.
Okay, sir. Okay.
Yes.
Thank you, sir.
It would have been better be referee.
It's all right. Oh, it's all right. So can we make progress?
Yes, sir.
Yes, sir.
Okay. There are techniques that are adapted in psychotherapy. Yes. So several times when people hear the word psychotherapy, a lot of things run through their mind. They are thinking of a patient lying on a couch, and then the therapist or talking while the therapist sits somewhere in a nearby chair, jotting the patient's thoughts on a jotter. Most often than not, that's what people think psychotherapy to be. But psychotherapy goes beyond just lying on a chair and then lying on a couch, and then the therapist having an orange or pink jotter jotting your thoughts. It takes different techniques or different techniques or approaches. The first approach or technique in psychotherapy is called behavioral therapy. It is called behavioral therapy. Behavioral therapy is derived from the word behavior, isn't it?
Yes.
So we say that therapy means what? Treatment. So if we talk about behavioral therapy, it means the behavior is treated, isn't it? Hello?
Yes, I do.
Sir, it is, sir.
Okay. Yes, when we say behavioral therapy, therapy means treatment, and behavior are our individual characteristics. And our behavior is a product of our traits, our temperament, and our genes. So it means that our behavior is treated. That's what behavioral therapy entails. So when behaviorism became a more prominent school of thought during the early part of the 20th centuries, conditioning techniques began to play an important role in psychotherapy. Now, an individual manifests a behavior. The behaviorists are saying that maladaptive behavior is learned. That maladaptive behavior is what? Is learned. Is that okay?
Yes, sir.
Yes,
It is
sir.
a product, or our maladaptive behavior is a product of certain conditions. So if for us to be able to change, to be able to modify these behaviors, certain conditions must also be in place. So the behavioral school of thought are saying that maladaptive behaviors are learned, and for you to change them, you must unlearn this behavior. And the proponents of this approach to therapy are called behaviorists, or the movement is called behaviorism. And the proponents of this school of thought are people like Ivan Pavlov and Buluskina, and people like Albert Bandura. For those of you who are educationists or who took some courses in education or educational psychology, you will hear what the educational psychologists say, that the human mind the individual child is born with a blank mind, and the environment writes on it. They call that tabula rasa. And the behaviorists, Albert Bandura, say that give me 10 children, I will train one to be a thief, I will train one to be a pastor, I will train one to be an engineer, I will train one to be a wizard. I will train them in different aspects because the environment is writing on that mind. Are we together? So for us to be able to understand the focus of the behavioral school of thought or behavioral therapy, if you will go very quickly back to our nearby environments, and for those of us who have children, when you give birth to a child, the child's mind is blank. He doesn't know how to call daddy, he doesn't know how to call mommy, he doesn't know how to call baba, he doesn't know how to call mama. As he sees and hears you calling, you know, the child also develops the ability to call baba and call mama and call daddy, isn't it?
Yeah.
As the child begins to play around the environment, he knows how to insult people because the children around him are insulting. While the child is here to go to school, the child also begins to speak English before going to school, because the children around him that go to school come back and asking him, how are you? Say fine. How are you? Say fine. And he's able to understand that when you say, how are you? The response is fine. Isn't it?
Yeah.
It is.
So good behaviors are learned and bad behaviors are learned. Maladaptive behaviors are behaviors that deviate from the normal acceptable behavior in a society. And they include behaviors like deviance, you know, deviant children, you know, wayward children, you know, bullies, narcissistic children, children developing conduct disorder, as we saw in our psychopathology, isn't it? Then you also see people coming down with mental illnesses as a result of taking substances, psychoactive substances, such as marijuana, such as choke, such as what do you have them? Impurumiri. The list
Tramadol.
is endless. Tramadol, the list is endless. Now, these people that have embarked on this journey, one, they lack understanding of the end of that journey. But they do it because there is a behavioral influence. There is an environmental influence on them. So they learn to smoke, they learn to drink, and they learn to do certain things that they are doing. Now, these things cannot be changed until they unlearn them. They learn how to not do it again. So the behavioral school of thought or the behavioral therapy is saying that individuals' maladaptive behaviors can be changed by modifying their behavior through behavior modification techniques. Through behavior modification techniques. Do we understand?
Yes, sir, we understand.
And these techniques help the individual to unlearn certain maladaptive behavior that they have adapted over time. And the behavioral approach has several techniques that it puts in place. For instance, an individual who develops fear over certain objects, maybe fear of dogs, can be helped, you know, to stop fearing dogs using systematic desensitization as a behavioral technique or therapeutic approach. An individual who often is a deviant, his behavior may be reshaped or may be modified using what is called token economy. That for each act of good behavior exhibited, he receives a token. That token reinforces him, you know, to continue doing that behavior that is desirable or accepted. So by way of definition, we can say that this reinforcement itself is anything that has the probability of increasing the occurrence of a desirable behavior and decreasing the occurrence of an undesirable behavior. So token economy entails that, and token economy as a principle of reinforcement entails that an individual is rewarded with a token, is rewarded with a prize, we're rewarded with a gift when he exhibits a desirable behavior. And this reward is encouraging him to decrease an undesirable behavior. And then we have other techniques like other behavioral therapy as like relaxation therapy. In relaxation therapy, the individual is taught to relax.
Network has started again. Network has thrown dog out. Simeon, are you hearing? I'm here. Okay. Good morning, Samedugu. Morning, sir.
Good morning, Mr. Takwe.
Jiba, good morning.
Morning, sir.
Good morning. Oh.
Don Jigba.
Sir.
Big name. Good morning.
Jigba. Jigba. Hello?
Yes, sir.
Ma kwasho bunde.
Hey, kan network adoga eh.
Ai, na wa network nengo nasa za yo. Nyenza nzanje. Ai.
Da kuya pay Mike Woga.
Are we safe? We are safe. Mr. Silas, am I?
Thank you.
We're still waiting for Dr. Shimaka.
Okay.
Yes, we are back. So we were saying, can you hear me?
Yes, Doc, we can hear you.
Okay. So we were saying, we were explaining behavioral therapy, and we say that the aim is to change the maladaptive behavior to become adaptive. So for cognitive behavioral therapy, we were simply saying that cognition has to do with our thought process. Are we together?
Yes, sir.
How our
Yes,
thought process influence our behavior and our everyday functioning. Now, if we have negative thought process, they are going to influence how we function. And that affects the way we behave. So the cognitive behavioral school of thought is of the option that, or is of the opinion that our thought process determines how we behave. They determine how we behave. They influence how we behave. If you tend to see the negative aspect of a situation, you will probably have a more persistent outlook and you look gloomier, you look depressive, you look dull, and you are moody. Now, for instance, if you give negative interpretations to situations, then you also react negatively. Let's take this example. You went to your village and there is this bird that flies and perches on the roof of your house or on a tree in your compound. You know, amongst the two people, and is hooting, "Boo, boo, boo." Anybody that gives a negative interpretation will say that his kinsman wants to bewitch him, isn't it?
It is, sir.
Yes.
If you don't interpret it from a negative perspective, you know, you will go on with your normal functioning in life. But the moment you begin to give negative interpretations to the hooting of the birds, or the bleating of the sheep, or to the way people behave, then your thought process is wrong. Your thought process is wrong. And it begins to affect the way you behave. It begins to affect your relationship. The reason why people go to several churches and end up being at a minity, end up breaking up with their family members and refusing to relate with them, it is because those people have played with their psyche. They have reshaped their thought process to look at their family members as being witches and wizards. So psychotherapy in this form helps reshape the individual's negative thought process to positive thought process that will enhance well-being and improve interpersonal relationship. I don't know if that is understood.
Yes, but I have a question there, sir.
Go ahead.
Okay, sir. Good morning, sir.
Good morning.
Yes. Does that mean, like the example you just gave now? Yes. Does that mean that even if a negative things are happening around us, or we feel that this thing is doing whatever is happening is not good? For example, like the issue of the bed you just mentioned, petting in the house or in the tree in the house, a sign people tend it to be a negative omen in the house, or something is about bad is going to happen. Does that mean that doing things like that cannot be real? For one to believe that, yes, if it actually happened, it is real? Or does it mean that we can, okay, when we see that, you said, okay, let me turn a positive side of it, believe that it's going to be positive, and then it end up happening in a negative form?
They are superstitious beliefs.
We have superstitious beliefs. It is normal for that bird. That's the hooting style of that bird. Are you understanding? Hello?
We are with you, sir. We are here.
Yes, sir. Yes, sir. I'm hearing you, sir.
The bird has been created to hoot that way. Now, if you just go to the village and that bird hoots and you are interpreting it negatively, this is different from where you are having strange things happen, where you are having your kinsmen fighting with you over a particular matter, and they are looking for a way to eliminate you. For everything that happens around you, you give a negative interpretation to it. Isn't it?
Absolute truth.
It is.
Yes.
It is, sir.
But a normal person begins to give negative interpretation, it is certainly going to affect your behavior. Is it not?
It is.
You heard that when that bird
For
hoots,
sure.
when that bird hoots like that, it means there is a problem. And there is no problem, so the bird should not hoot. Because when it hoots, it's a problem. Your interpretation. So when you come to the therapist, remember we say that just like in in counseling, there is an assessment process that the therapy assesses your thoughts and your situations. He elucidates information from your histories, beginning from your personal history to your educational history, to your family history, to your social history, to your drug history, to your forensic history, to your psychosexual history, to your medical history, to your mental history, so that he can be able to come out with something to substantiate the veracity of what you have said or to discard it. I don't know if that is understood.
Yeah, it's understood.
Have I answered that question, that concern?
Yes, sir.
Okay.
Thank you, sir.
You're welcome. So next from the cognitive is the humanistic therapy. The humanistic therapy was started by championed by people like Carl Rogers, And he developed the client-centered therapy. Remember yesterday, we were talking about client-centered approach in counseling, where we are saying that the client is at the center of counseling, and all that the counselor is doing is set geared towards improving the well-being of the client. Carl Rogers developed a therapeutic approach called the client-centered therapy. That the client is at the center of treatment. That is what that means. That everything that the therapist is doing, he is showing unconditional positive regards to the client. Remember, we said that in counseling, your client must be treated with respect. He must be treated with respect. So in therapy, the client-centered approach is focused on the therapist showing the client an unconditional positive regard. Unconditional positive regard in the sense that he is not judging the client for his wrong mistakes, whether he had made mistakes or not. His focus is for the client to be able to improve his well-being. His emphasis is helping people or clients to maximize their potentials and reduces stress. He gives them the room to explore themselves and attain self-actualization, to see their strength, to develop inner strength, to have self-worth, to have self-value, to have self-esteem, rather than looking down upon themselves in comparison with others. But here the client is able to identify his own strengths, build on them, and overcome his own challenges. I don't know if that is understood. Is that understood?
Yes.
Yes, yes, sir.
Yes,
Is
sir.
there any question or we can make progress?
No question for my answer.
So the next approach is called the psychoanalytic therapy. Remember when I was trying to give you a definition of psychotherapy? I say anywhere you see psycho, it is mind. And when you say analytic, means the mind is being analyzed in treatment, isn't it?
Yes.
So the psychoanalytic therapy is championed by Sigmund Freud, who began using his therapeutic approach to work with patients. And the techniques used by Freud in analyzing the individual's mind include analysis of dreams, analysis of transference, and free associations. This involves delving into a patient's thoughts and past experiences to seek out unconscious thoughts and feelings and memories and see how those individual memories influences behavior. So in psychoanalysis, Sigmund Freud analyzes an individual's mind, and he says that the individual mind is divided into three: the conscious aspect of his mind, the subconscious, and the unconscious aspect of the individual mind. The conscious aspect of the mind is the one that we see everywhere. When we look at a man and his behavior, we're able to provide interpretations to his own behavior. Then the subconscious is that aspect that you need to interact with the individual, build the rapport before you are able to uncover the hidden things of the mind. Then we have the unconscious, which is deeply hidden until the individual mind is being probed. So the individual hides a lot of things in the unconscious. And most of the times, this unconscious most of the times things that are hidden in the unconscious, they also manifest in dreams. And when you interact with an individual, you will notice that he quickly says something that he has not intended to say. And he says, sorry, it is a slip of tongue. Sigmund Freud said, no, it is not a slip of tongue. There is nothing like slip of tongue. What the individual said is what he has kept in the unconscious mind to release it at a particular time. But unfortunately, it came out, unnoticed. So there is nothing like a slip of tongue. So the unconscious mind is delved into. And the things an individual hides in his unconscious mind tend to influence the way he relates with people, the way he behaves. So individuals who were abused during their childhood days, individuals who are maltreated, who are subjected to inhuman treatment, people who suffer traumatic events during childhood days, they hide these things in their mind until an in-depth assessment brings them out and they are addressed. So Sigmund Freud said the individual mind is being analyzed to bring out hidden issues that tend to influence the individual behavior. Are we there? Have you understood this?
Yes, sir.
Yes, sir.
Any question? Any question?
My hand is up, sir.
Okay, Lucy. Yes. Yes, Lucy,
You,
go ahead.
Sigmund Freud, you say he said there is nothing like a slip of tongue.
Yes. There is nothing like slip of tongue.
But in reality, there is something like a slip of tongue.
There is nothing like slip of tongue, Lucy.
But I find it difficult to accept that postulation.
Okay, let's look at it this way. We are talking, and I say, maybe we have a conflict, isn't it? We have a grievance. And I am planning to one day mobilize people to beat you up. I am planning them within myself because I am planning them and I don't want you to know I have been very nice to you, isn't it? Is Lucy with us?
Yes, sir.
So maybe in one of our encounters, we have a heated argument and I say, don't worry. You and one day, the way I will just mobilize people to deal with you. And I say, sorry, I didn't mean it. Does this really mean I didn't mean it?
No,
or I didn't
sir.
mean what I said? Is that a slip of tongue?
No, sir, but there are different types of slip of tongue.
Okay, mention them.
Like maybe an Okada person asked me, I stop him and he tells me, where are you going to? And I tell him. And he tells me, okay, 500. I say, no, maybe I just made a mistake. And I said, okay, how about instead of saying 300 naira, I say 30 naira.
That one is not that is not a slip of tongue. The tongue, slip of tongues entails that your tongue has slipped to say what you do not intend to say. You have planned, you have said what you want, you are saying what you have planned to say or to do at a time you don't want to say it. This one you say is a mistake. It's not a slip of tongue.
So, sir, in essence, what you are saying now
Hello,
is that
hello, sir.
whatever
My
thing
hand
that
is
come,
up.
hello, sir.
Go ahead.
Okay, sir. Sir, then what is the difference between mistake and slip of tongue?
A
Because
mistake,
what Madam Lucy asks, I'm saying it in the way that it's a mistake.
Sir, can I come with Genga's question?
okay, go ahead.
Genga, before you make a slip of tongue, your subconscious is already discussing that with you before you voice it out. But mistake is something that you voice out without any subconsciousness.
Thank you.
Hello, sir.
Yes. John.
Does that mean that anything that comes out of one's mind or mouth is already premeditated? There are times that you may have so many things within your mind. If I'm talking to Mr. A, maybe at the point of talking to Mr. A, a word that is not meant for Mr. A, that is meant for Mr. B, may likely come out of my mouth at that particular time. And I said, no, excuse me, that word was not meant for you. Is that not a slip of tongue?
Is it coming from your unconscious part of personality?
Yes.
Of the mind?
Yes.
You have kept it there. You meant that you will give it to Mr. B, isn't it?
Yes, and I mistakenly take it to Mr. A.
You mistakenly took it to Mr. A.
Yes.
Because you were not intending to say it to Mr. A.
Yes.
It's a slip of tongue. We are saying that there are a lot of things in our unconsciousness that we don't want to release them. At that particular time, we are releasing them. Then situations triggers you to release them. It is not a slip of tongue. A slip of tongue is not a mistake.
Okay.
For example, sir, like you have a friend, Ocheme.
You want.
You have a
There is
friend,
an accidental discharge. A slip of tongue is like an accidental discharge.
Discharge.
Okay.
Let me give you an example. Sir, let me give you an example.
Okay,
Ocheme
go ahead.
is like you have a friend who is married. Yeah, we have a friend who is married, and it's usually cheating. You are the friend, you don't like friend or lifestyle outside the marriage home. So by the time you're intending, you don't like that. One day you're talking with your wife, already you mentioned it that your husband is cheating.
Accidental discharge.
Your subconscious already was telling you that you don't like that.
Yes.
Yes. Okay. Okay.
Is that understood?
Yes, thank you so much.
It's okay. So have we understood the psychoanalytic therapy?
Yes, sir.
Okay. So there are certain aspects of certain category of issues that psychotherapy can help with. So psychotherapy deals with people who have issues, or is a treatment for people who have issues with addiction. People who have issues with addiction. It deals with people who have anxiety disorders. It deals with people who have bipolar disorders. It deals with people who have depression. It is used in helping people who have eating disorders. It helps people who have obsessive compulsive disorders. It is useful in treating phobias. It is useful in treating post-traumatic stress disorder. It is useful in treating substance use disorder. It is also useful in treating people with chronic pain or serious illnesses. It helps people with divorce issues or breakups. It is used in helping people come out of grief or loss. People who suffer lack of sleep, what we call insomnia. people who have a low self-esteem, people who have relationship problems, and people who have stress issues. So psychotherapy helps in handling some of these issues that we have mentioned. And how can I be able to get the best out of my psychotherapy visits? Remember, psychotherapeutic visits are just like counseling visits. You visit a counselor to receive help. You can also visit a therapist in his therapeutic office. The therapy can take place in the hospital or in the treatment room, as the case may be. How can a client get the most out of his therapeutic visit? You know, when you are going to see a therapy, you have a problem and you want to get help, isn't it?
Yeah.
So how can you get the most out of this session? The first thing is that as a client, you must be honest with your therapist. People say that there are 3 people in this life that you must not lie to. You must be honest to. Say the first one is your pastor. The second one is your lawyer. And the third one is your doctor. That's what people say. But I say that there are 4 people or 4 persons you have to be honest to. The first person is yourself. The second person is your therapist. The next one is your doctor. The next one is your lawyer. Yourself, your pastor, your doctor, your lawyer. So when you go to the therapist and you are not honest, it is very difficult for the therapist to help you. But also in situations where the therapist also noticed that the client needs help, but he is lying. We have instruments, we have test instruments that have lie detectors that are administered to the client. And you see him showing that he is actually lying. For instance, when you assess people for either deviant behavior or psychotic behavior using the Minnesota Multifaceted Personality Inventory, MMPI, it has a lie detector scale that helps to detect all the lies you have said, you have told the therapist. When you also assess people's personality using the NSYNC personality inventory, it also has a lie scale embedded in it that helps prove that you are actually lying and you are not truthful to yourself. So one way you can get the most out of any therapeutic session is by first being honest to your therapy so that you can be helped. Secondly, you must feel your feelings. Feel your feelings. Do not hide negative or distressing emotions. If you have emotions that are distressing, express them so that the therapist may be able to identify them and also help you come out of them. And then you must be open in the process. You must be open to a genuine therapeutic alliance, a sincere alliance that is therapeutic, that is healing in nature. So that at the end of the session, you will not just be experiencing feelings of uneasiness because you refused to open up some areas of your life. You know, while we were discussing behavioral therapy, I said that the therapist assess. There is a point of assessment. And assessment is that interaction, that long interaction with the client in order to get information about the client's problem. So the therapist, you will notice that the therapist will ask you a lot of questions, personal questions, social questions that ordinarily in a normal discussion, no one would want to ask you. The aim is to see how best as a client, you can be helped in the therapeutic process. Then another way you can get the most out of your therapeutic session is by attending your sessions. You don't need to miss sessions or sessions are scheduled. When you begin to miss sessions, the therapists also feel you are not serious with your sessions. And then if there are homeworks that are given to you in the course of the session, it is expected that you do these homeworks as it has been assigned to you, so that you can receive the utmost help out of your interaction with the therapist. Is there any question?
Yes, sir.
Yes, sir.
Okay,
Yes,
go
sir.
ahead. Yes.
Only once again, Doc. So,
Yes,
you
go on.
mentioned some persons that one have to be honest with. And let me use a medical doctor as a case study. That when if you are honest with your medical doctor, and in return the person is not honest with you, in that situation, what are we going to do? Because I found out a situation where there are some persons who found themselves in the hospital, and before you know what is not even disturbing them, the medical doctor will now say, this thing that this is disturbing, in order to, in fact, get more money. Then in that situation, what is the solution?
Okay, in the context of our lectures, we are talking about a psychotherapist. Are we together?
Yes, sir.
We are not talking about the medical doctor. There are ethics of medical practice. If you go to the PGD class, we had taken a course, social standard in medical and mental health. We were discussing issues of values, beliefs, in perception of values, beliefs, and relationship in practice in medical and mental health. And we spoke about the values and the belief of every profession, every professional working in rendering service within the communities or within the society. Now, every profession has ethics that guides professional conduct. Now, where a doctor, a medical doctor, is not sincere, and you have uncovered that, you have right to petition him to the Medical and Dental Health Council so that your matter will be redressed. There are several issues that are addressed at the Medical and Dental Councils. Even here in Nigeria, there are people whose license have been withdrawn. There are people who have been banned from practice for a number of years. In psychotherapy, the emphasis is that the psychotherapist must assure the patient of confidentiality. The psychotherapist must also build a therapeutic alliance, not a social relationship. That alliance is a healing alliance that the patient receives healing as that relationship is being built. And it is a relationship that is based on trust. So if that alliance is built and that relationship is based on trust, trust is reciprocal. So the client also needs to be honest with his own expressions so that the therapist will be able to help him come out of his distress. Even in therapeutic service, when you cannot provide quality therapeutic treatment to your clients, there are channels of redress because there are ethical considerations. There are ethical considerations. I don't know if I have responded to you.
Yes, sir. So, and again, in this psychotherapy business, do they have anything like a referral, like
Yes.
in counseling?
Yes. I mentioned that earlier on at the beginning of the class because we were discussing psychotherapy in reference to counseling that we discussed yesterday. And we see that even in psychotherapy, there are areas of specialization. There are people who are specialized in couple therapy. There are people who are specialized in group therapy, psychotherapy. There are people who are specialized in individual therapy. There are people who are specialized only in assessment. There are people who are specialized in certain aspects of treatment. It could be CBT, cognitive behavioral therapy. It could be rational emotive behavioral therapy. It could be dialectical behavioral therapy. It could be any form of therapy. Now, when you assess your client and you also observe that the best treatment approach that can help him is a cognitive behavioral therapeutic intervention, and you are not skilled in that area, you put a referral, you discuss with your client why you are referring him, that you are referring him for expert management, and you refer him to that person that has expertise by giving that client a referral note. So there is referral in psychotherapy too.
Excuse me, sir.
Yes, Ted.
Hello, sir.
Yes, Ted, I'm with you.
Hello, sir.
Yes, I'm with you.
Is this referral the same with channels of redress?
No, referral is different from channels of redress. In referral, you are sending the person to an expert for more expert management, isn't it? When you go to the hospital and the doctor who sees you, in the hospital, when you first go to the hospital, there are two entry points. You either go through the accident and emergency department where it is an emergency, or you go to the general outpatient department. Now, in the general outpatient department, you see general practitioners. They are called family medicine. They are family consultants who look at you. They assess you and they say, okay, this is your problem. You need to see a specialist. He refers you to the specialist outpatient clinic, either in a medical clinic, surgical clinic, pediatrics clinic, nephrology clinic, endocrinology clinic, as the case may be. That is a referral. When you feel unjustly treated in the hospital, or when you feel that you are unjustly treated, or a therapist have taken an undue advantage, you seek redress. Redress is like a complaint. It's not a referral for expert management. It's a complaint against a treatment that has been given to you. So there are two different things.
Thank you, sir.
You're welcome. Is there any other question? So in conclusion, we can say that psychotherapy can be helpful for people who are experiencing a mental health problem. Remember, when we say mental health problem, we are not saying mental illness or mental disorder. There are a lot of mental health problems that people are experiencing. But it can also be beneficial for people interested in learning new coping strategies. You may not have a mental health challenge, but you are interested in learning how to cope with emerging situations. Or it can also be helpful to people who want to have more understanding of their own thoughts and experiences. Such people can also visit a psychotherapist and have this experience. Is there any question?
No question.
The last time we gave an
Hello, sir.
No question, sir.
Yes.
Hello, sir.
Yes, sir, Ted.
Sir, I'm not very clear with that assessment. Hello, sir.
Assessment?
Yes, the area you talked about assessment, I didn't get it very well.
Okay, assessment is derived from the word assess. And in this context, it means traveling around the thoughts of an individual. Traveling around the thoughts of an individual. Bringing out issues that are problematic to him so as to help him overcome them. You come to the hospital, you have a problem, isn't it?
Yes, sir.
In psychotherapy, there is a rapport. You come before the therapist. He welcomes you into his own therapeutic setting. And he engages you in a conversation. Yesterday, we were looking at how to create a rapport while we were discussing counseling. And we say the client walks into your office and say, good morning, welcome. Can you please sit down, have a seat? And then while the client sits down, you are expecting the client to talk. But you have noticed that the client is feeling uneasy. And you say, you introduce a discussion that can dispel his anxiety and his tension. Maybe you bring an issue of football, and then you dose down that tension, and you tell him, I am Ted Chago. I'm a therapist. This is my office. This is where I work. You are welcome into the therapist office. Please feel relaxed. Feel free to discuss anything you feel we can discuss that can be of help to you. And the client says, yeah, because of A, Y, Z, Z, isn't it? You begin to ask questions. You begin to probe. You begin to do an assessment. You tell him, okay, we are going to interact, but in this interaction, I'm going to ask you a lot of questions. Please don't feel angry. Any question that you don't feel comfortable responding to, you let me know that for this aspect, I wouldn't want to respond to it. But I'll be asking you several questions. I will be discussing with you, going through several aspects of your life. They could be personal, they could be work related, they could be family related, they could also be school related, isn't it? And then you begin to ask the client, can you tell me how many of you are in the family? Then he tells you, we are 4, we are 5, we are 6. Oh, can you narrate the relationship between you and your parents, you and your siblings? And the client is telling you stories about his family, and he's mentioning situations. You know, when you make the client talk, the client is able to tell you a lot of things that are problematic, and then you are noting areas of problem, you are jotting them down. And you also inform the client that some of these things you are sharing with me, I will really need to note them down so that we can discuss them further. That's assessment. That's assessment. So when you finish traversing around the individual's life, then you sieve out the problematic areas, and then you begin to probe further. So in psychotherapy, the therapist, in assessment in psychotherapy, the therapist asks the client questions, and the question provide responses, and the therapist question the responses until responses have become questions have become unanswerable, and answers have become unquestionable. The aim is to arrive at the root cause of the individual's problem that is causing distress. I don't know if I have responded to you.
Yeah, thank you, sir. It's clear now. I understand it now.
It's all right.
Thank you.
So is there any other question? If there is none, Fayam, are you with us? Fayam.
Okay, sir. Sir,
Yes, I'm with you, sir.
Okay, fine.
Yes, go ahead, Ted. You wanted to say something.
Okay, yes, sir. I because of in the course of this discussion, I now understand why these people, those therapists, they ask repeated questions. They will continue to ask you the same questions every time you visit, every time you go to them. They'll ask you a series of questions, the same thing every time. So now I'm beginning to understand why they ask those questions.
Yes.
Thank you, sir.
The aim is to help the client come out of his challenge at each point in time. Yes, Fire. Mr. Tiokos, are you there?
Yes, sir. I'm here with you, sir. Okay. I don't have any questions to ask at the moment, sir.
I'm not asking you. I'm not calling on you to ask questions. I'm calling on you to do an assignment. Okay,
sir.
So just like we grouped the class the last time, here is a group assignment. Here is an assignment that is going to be done in group. This is an assignment for us. We're going to do them. We're going to do this assignment in our group. Is that okay?
Yes, sir.
It's all right.
Yeah, so
Okay, sir. Excuse me, sir. So should we maintain the last semester's group, or there should be new grouping?
you can maintain last semester's group. You can do a new grouping. Which one is more appropriate for you?
So I guess we should maintain the last groups.
Oh no, I think it's something we should go back to the class and discussion group and then discuss it, so that maybe some people might not really like the groups they were inside. So we might just swap to ensure that there is more interaction within us on an academic level, not repeating same groups. We'll discuss and then get back to you, sir.
Okay, your assignment question is discussed using relevant examples, the 12 healing factors in group psychotherapy. Is that noted?
Yes, sir.
So
yes, sir.
I'm going to reshare these presentations with Tiokoso, and he will share it with you. So on that note, we have come to the end of the first segment of this this course. By tomorrow, Dr. Dorothy will continue with you, taking the last component that has to do with theories of psychotherapy and counseling. So wish you happy time learning with Dr. Dorothy.
Thank you very much, sir.
Peradventure,
Thank you, sir.
peradventure in the course of going through the material, you have challenges, you are free to call my attention and we can address them appropriately.
Thank you, sir.
Thank you very much, sir.
Thank you, sir.
You're welcome.
Thank you, sir.
Thank you.
Thank you very much, sir.
Thank you.
Thank you. So do have a lovely day. Yeah.
Sir.
Same to you, sir.
Yeah.
Sir, another question. What's the duration for submission, sir?
When are you starting exams? 2 weeks to your exams.
Okay, sir.
2 weeks to the exam.
Is this the end of the course?
This is the end of the aspect of the course I am taking. You will continue
Okay,
tomorrow with Dr. Dorothy.
Okay, sir.
It's all right.
Thank you very much, sir.
You're welcome. Thank you.
Thank you very much, Doc.
Have a nice day.
Wish you same, sir.
Thank you.
Hello, class.
Yeah.
Hello, Desmond.
In the absence of no announcement, I'm ending the meeting. I'm the host.
Thank you.
End it,
All right.
Mr. Hope.
Thank you.